Welcome to the Medical Minute podcast. I'm Anne Connell, a Melbourne-based GP.
And I'm Moz Calafella, also Melbourne-based GP.
Welcome to what will be our last podcast for 2024. But before we dive into what we're up to, I'll remind everyone this is meant to be education and entertainment and not a substitute for advice from your own healthcare provider. Dr Moz.
Indeed. Maybe a little bit of housekeeping as well before we move on. So this podcast will be our last podcast for 2024. We're going to take a well-deserved break over the festive season, and we'll sort of be back recording podcasts and hopefully releasing our first one somewhere in mid-Jan, I think 18th of January. And another small adjustment to the way that we'll be releasing the podcast is from next year, we'll be going fortnightly, won't we, Dr. Anne?
We will, yeah. Every 2 weeks, I think, will be more sustainable for us. Hopefully keep everyone engaged, yeah.
Certainly producing the podcast has turned out to be a bit more than we anticipated in terms of workload, but we think it's worthwhile to make sure that the quality of the podcast stays as high as possible. So we'll try and get that out every fortnight, hopefully to maintain quality. And Dr. Anne, what could someone potentially do if they are missing the podcast over the holiday break?
Well, it would be a great chance to catch up on any that you haven't listened into just yet. So we will have the links to the Spotify and Apple and YouTube, and you can listen or watch to your heart's content if you're missing us. Yeah.
Indeed. Hit that back catalogue and catch up on all the news that we covered last year. So, Dr. Anne, let's dive into it. This podcast, we are talking about some festive season first aid, aren't we?
We are indeed. Obviously, it's year-end, holiday time. School's about to be on holiday if they're not already. But unfortunately, family gatherings, warm weather, lots of outdoor time, sometimes results in minor mishaps. And it's nice for you guys to be sure how you should be handling those. So we'll just run through the headlines of those today, and hopefully you'll find it helpful.
Teeny tiny little refresher course just before everyone goes into holiday is probably not a bad idea, we thought. So, Dr. Anne, first cab off the rank, which version of injury are we covering first?
I think we might start with burns and scalds, because I think they're probably like to be the most frequent minor mishap that's going to happen, sadly, over this holiday period. I mean, we're not wishing any medical mishaps on anyone, and we hope you make it through the holiday season unscathed. Just in case, let's talk about burns and scalds.
Yeah, so a common occurrence, around barbecues, around cooking events, and so on and so forth. And so I guess we're going to cover some of the first aid, but I think one of the things that we should talk about before we cover the first aid is just actually making sure that you actually do check that the area is sort of safe to begin with, and you're thinking about burns and scalds. And I think specifically around Christmas time, often people are thinking about having barbecues. So we just want to make sure that we actually give the barbecue a really good clean and make sure that you get in there and clean out all of the gas pipes if you're using gas, and make sure you're not using any, significant accelerants or anything like that, so you don't increase the risk of having a burn. But let's say we have sustained a burn. What are we doing?
Immediate first aid for a burn is to get the affected area of skin under cold running water and keep it there for 20 minutes. Which seems like far, far too long. Most people probably only do 60 seconds and then try to move on with their life. But the Royal Children's Hospital...
Seen it live, yeah.
Yeah, are very, very clear. 20 full minutes. Set your timer. We love you setting a timer, as you know, from previous podcasts. But then set your timer. The only thing that you would pause to do if someone actually has jewellery or clothing over the area, then it would be reasonable to try, if you can easily do so, remove those first in case the affected area starts to swell. But if they're already stuck, you would leave them alone. But cold running water for 20 minutes.
And I think even if you can find cold running water, get the burn in underneath there, and like you said, whip the jewelry off as you're running it under cold water. There's no reason you can't do both if it's if you've got the water source that would support that. Yeah. So definitely people are often guilty of not putting their burns under cold water for long enough, but get the area clean, get the area sort of bare, and get the area under some nice cold running water for a very, very long time, a much longer time than you think is sensible.
Yeah, and it's actually worthwhile doing that. Even if the burn or scald has happened up to 3 hours ago, it's still worth doing that 20 minutes under running water. So if someone who's not you has been in charge of the person who's had the burn or scald, and you arrive on the scene later, If it's within 3 hours of the time and the 20 minutes hasn't been done, it's well worth starting the clock and doing it now.
And unfortunately, that's the case, because if you've had a good going burn, you're actually potentially still cooking on your insides from the heat. So we really want to stop that ongoing cooking. We really want to stop that ongoing thermal injuries, that we can hopefully help speed up the recovery once things are done. Dr. Ann, I've got a really good idea. What about ice? Can I just ice it?
Please don't ice it. Never ice it. You just can add a cold injury to further damage and insult the skin. And please don't. And you must have, if you don't have running water available to you, but you do have some sort of cool water, then you can soak a towel and put the soaked towel in cold water, put that over the burned or scalded area, and then frequently re-wet that and reapply it. But please no ice. You're just further injuring the skin.
Yeah, absolutely. And once we're done with the 20 minutes of ice cold water, next step is?
So in almost every instance, you're probably wanting to seek medical review, unless it's the teeniest, tiniest of superficial burns. Then, so really, if the burn is the size of a 20-cent piece or greater, you should be seeking medical help. Yeah, would you agree with that, Dr. Moz?
Yeah, absolutely. So I think the other thing that's tricky with burns is there are a few burns that are quite special. So sometimes people don't realize that they've got a special burn. So I think if you've got a good going burn, even if it's the middle of the night or after hours or whatever the case is, it's probably worth being in touch with a virtual ED or an urgent care center just to try and help you work out, is this a burn that needs to come into the emergency department or not? Because a lot of the time people underestimate how significant their burns are.
Yeah, and as you sort of hinted at earlier, burns are dynamic injuries, and they actually continue to evolve over 2 or 3 days, which is why within that 3-hour window, it's worth doing the 20 minutes of cold running water. But yeah, so the burn can actually be much more severe than you first realise. So much better to get medical advice so that you know what you should be doing with it. So if you've done your 20 minutes of cold running water, you've decided that you do need medical advice, that you're heading off to a priority care centre for someone to have a look at it. What should you do with the wound while you're travelling? How should you protect it, cover it? Should you do anything? What would you suggest?
So we do want to do something with it, because unfortunately there is also a risk of infection with these wounds. And so they're very, very good at getting infected if we don't protect them. And so what I would say is, if you have a dedicated burn dressing in your first aid kit, amazing. Use that. If you don't have a dedicated burn dressing in your first aid kit, then often Vaseline or cling film, or a combination of Vaseline and cling film together, is probably a really good idea. And that will hopefully help protect the skin until you can get medical care and get an appropriate dressing.
Yeah. Important thing with the cling film is not to wrap it circumferentially around if it's an arm or a leg. So you're not wrapping it so that you're sort of sealing it and putting something tight on the limb. Ideally, you sort of place it what we would call longitudinally. So on an arm, for instance, that would be from the shoulder to the fingers in that direction, so that you're not at all compromising the supply of blood to the fingers beyond the cling film.
Because it'll swell, like you've said, Dr. Ann. So we just want to make sure that it sort of has an opportunity to be able to swell without causing some sort of blood vessel related injury.
Absolutely. Another thing that, of course, particularly if it's your child, is perfectly fine, normal and reasonable, and the right thing to do to give them something for the pain.
Yeah. Absolutely. One more question actually that pops up quite a bit with burns, and I think you've covered it here in the show notes, is the blisters. So often if it's a really nasty burn, you'll get a little bit of a blister. Medicine over the years has changed its mind quite a bit, but probably for the last 10 years or so, very much the advice has been pretty please don't pop the blister. This again can increase the likelihood of infection, and even if the skin's dead on that blister, it's acting as what's called a biological dressing. So it's just protecting you from bugs so you don't get an infected wound. So don't pop them. If it pops on its own, that's fine. It's not the end of the world, but we wouldn't go actively popping these blisters if we could avoid it.
Absolutely. That's probably all we want to say about burns and scalds. It's really the first aid, the 20 minutes of cold running water, and then the protecting from infection as you're going to seek medical help. Anything to add, Moz?
No, I think we've hit the highlight reel. I think that was more than a highlight reel for the burns. We spent more time on that than we thought we were. But I guess it's a common problem.
The 20 minutes of cold running water. People will have heard that bit. Yeah.
That's right. 20 minutes of cold running water. The next one's also a pretty common one, not as nasty as the burns, but still something that happens not infrequently. And I guess in the holiday season, you might find yourself sort of wondering what to do. But nosebleeds, I feel like
pretty common.
they're pretty common. They're very common in my house. Anyone who's actually met me in person will probably have heard me whinge about my children and their hay fever. So I feel like nosebleeds are actually a very common occurrence in my house. But yep, they might not be a common occurrence in your house. And so let's talk about how to manage them. What should we be doing if we've got a nosebleed, Dr. Anne?
Nosebleed is really like any other sort of bleeding that you actually just have to apply pressure to the bit that's bleeding for 10 minutes ideally, and then it will usually stop. But I guess the trick is that you need to know where the bleeding's coming from, and I think that's not a well-known fact, is it, Dr. Moz?
No, it's not. So we can use my schnoz if you like. Are we sort of down here or sort of up here? Where are we headed with the pressure, Dr. Anne?
Yeah. So nosebleeds almost always happen from an area that we call Little's area on the septum being the bit that divides the left side of the nose from the right side of the nose. And basically, Dr. Moz will point to where it is, but it's it's the soft part of your nose. If you run your finger down your nose from the eyebrows, you feel the bone,
Soft.
and then you'll come to the soft bit where the nose flares out. And if you pinch the left side to the right side, so that you're squeezing them both towards the middle, and you'll feel the septum, that's exactly where you want to be pressing, because it'll be the little blood vessels just there that will be bleeding 99% of the time. Yeah.
Mm-hmm. Yep.
But I see so often. Sorry, Moz.
I was about to say, just like the burns, do it for longer than you think.
Absolutely. 10 minutes is what is recommended. 10 minutes without stopping to see if it stopped yet. So, and usually it's a child. So you're the grown-up here, and you need to be calm. So you need to calm your child. They're probably better to be on your knee. Encourage them to open their mouth and breathe through their mouth. Sometimes people forget that they can breathe through their mouth as well as their nose, because you will be pinching their nose really firmly. They'll be breathing through their mouth, and probably tilt their head forward slightly, because if you get them to tilt their head back, because I've seen all variations of pinching on the bony part and heads tilted back. If you tilt their head back, the blood will trickle back, and most people don't like the taste of blood and can feel quite overwhelmed. So your kid is sitting on your knee. They are tilting the head slightly forward. You're pinching the soft bit of their nose firmly for 10 minutes. You're breathing through their mouth. And your job, mum and dad, is to distract them. Yeah? So you can read them a book. It
definitely used to be common wisdom, didn't it, to tilt your head back. But I think the reason people like doing that is because you don't see the blood. But just like you've said, the blood has to go somewhere, like you're bleeding one way or another. And so it's much better to tilt your head forward and let that blood sort of escape that way, rather than sort of let the poor kiddo swallow their blood.
Yeah. So you can read a book to them, you can sing songs to them. This is a situation where I think any healthcare provider would be quite happy for you to whip out your mobile phone and find, oh my goodness, whatever they want to watch on
Netflix,
YouTube.
Paw Patrol, The Investigators, whatever your kids are onto. If you'll indulge me, Dr. Anne, can I share a story about how I might win Father of the Year for 2024? So as I've said, my kids are like very prolific nosebleed kiddos. And I think it was midway through this year, at some point I was on the phone in the car, and my eldest said to me, "Dad, can I ask you a question?" And I said, "Not now, kid. I am on the phone. Is it really important?" And she said, "No, it's not really important." So I cracked on with my phone call for, 15 or so minutes. And then at the end of the phone call, I said, "Thanks so much, sweetheart, for holding your thoughts. What can I do to help you?" And she said, "Oh, it's okay. I've had a nosebleed and I've been holding my nose for the last 15 minutes. So unfortunately, she's a seasoned veteran and not a drop of blood was shed in the car, and she nailed it like a pro. So just unfortunately, I don't know that child protection would be happy with my behaviour. But so, yeah, just don't share this episode with anyone who works for child protection.
First of many things that your 9-year-old will not need you for, Dr. Moz.
Yeah, well, that's one way to look at it, isn't it?
Okay, Dr. Moz, so I've pinched my child's nostrils for 10 minutes. We've finished watching the whole episode of Coco Melon, and it's still bleeding. What do I do now?
Well, if you're my kid, you go get your mother because your dad's ignoring you because he's on the phone. But if you're not my kid, you just squeeze again for another 10 minutes. That would be the advice I would give if I was paying attention. Yeah.
Yep, absolutely.
And hopefully that second round of 10 minutes will do the job this time.
Yep, it absolutely almost always does. And then the next thing to do to level up in parenting, what you should then do is find a Zipper Duper or some similar substitute, and get your child to suck on a tasty ice pole. And why does that work, Moz?
So it's actually a very clever piece of design where the blood vessels on the top of your palate are shared with the, well, not exactly shared, but the sort of the nerves that control whether they're enlarged or small are shared with the nerves that control the top of the palate. So something cold on the top of the palate will shrink the blood vessels on the top of the palate, but it'll also do the same for the blood vessels in the nose. So a very clever piece of design.
It just helps. Now that you've stopped bleeding, keeping the bleeding stopped, because there's nothing worse than thinking it's gone and 20 minutes later we're bleeding again because you're bored with it, your child's bored with it. Usually you're at some sort of party or event because it's when kids are running around and excited and hot and maybe have had a little bump to the nose, that's when it happens. So we've got the bleeding stopped. We've had an icy pole of some variety to keep it going. And then for the next few days, how do we try and reduce the chance of it not bleeding again?
So for the second time in this podcast, we're going to suggest some Vaseline. So some Vaseline either with a cotton tip or with a very gentle, delicate finger, depending on the age of the child, just on the inside. So as you've said, Little's area is the main section, and that's sort of in that little component right next to the nose on either side. But to be honest, I would just dollop a nice amount of Vaseline on the inside of the entire nose. You want to be careful not to put too much Vaseline, otherwise your poor kid's not going to be able to breathe. We'd want to be lining and coating the inside of the nose, not completely obstructing the nose with Vaseline.
Yeah, that's not good parenting, yeah. I often sort of tell parents, it's interesting that we spend most of our life telling children not to put their fingers up their nose, but as it happens, most people's little finger is perfectly sized for putting in their nose, yeah? So if the kid is big enough, I often suggest that they get the kid to do it themselves, that if mum puts a little bit of Vaseline on their little finger, and they really just want to put their little finger as far up as the first little joint, and then wipe it on the middle bit, and that will usually be perfectly positioned. Yeah.
Mm-hmm. Yep.
Because you can go with a cotton bud, but if you're advancing your child's nose with a cotton bud, they think you want to do a COVID swab or something, and they are not happy with the situation. Whereas if you're giving them permission to put their finger up their nose, they're usually rather impressed.
They may feel differently. Yes. Yeah. So my experience might be different. My experience might be different because my children are used to me shoving things up their nose to try and manage their various versions of hay fever. Yeah.
It's easier to comply. Is that what in your household? It's just easier to let dad do his crazy things.
They've stopped fighting me. They've learned pretty quickly.
Stop fighting you over that, Dr Moz. There were many fights to come, trust me.
Many fights to come, yeah.
You'll be entertaining me over lunchtime for years to come, I'm sure, with what you do.
Indeed. Next up, button batteries, Dr Anne.
Yes.
What have we got to say about button batteries?
So we did a whole podcast on this a good few weeks back, podcast number 4, in fact. I'll put a link to that if anybody wants to hear the full version. But yeah, button battery ingestion. Christmas quite often involves some new toys for some children. Santa Claus comes to those who are good and sometimes those who are not so good. But seriously, some of these toys come with button batteries, and button battery ingestion is a problem. If a child swallows a button battery and it lodges in their gullet, then it can, even a dead battery can release a caustic substance that can burn through the child's gullet within 2 hours. So it's actually an absolute emergency if you think that your child may have swallowed a button battery. Yeah.
Yep, absolutely.
What should we do?
And I was about to say, we covered some very nice first aid the last time. The first thing is head straight to the emergency department. Do not pass go. Do not collect $200. Just head straight to the ED. That's if you're certain that something's happened. Don't encourage kiddo to vomit. So we don't want it, coming back up and getting stuck somewhere where it isn't. And I think that there is another little trick that we had up our sleeve for the previous podcast. I'll let you share that one with the audience, Dr. Anne. What else are we doing?
So if you have honey in your pantry and your kiddo is over the age of 12 months, then it's worth giving a couple of teaspoons of honey right away, and actually giving that every 10 minutes for up to an hour while you're transferring your child to hospital. And the thought is that the honey actually coats the battery and helps prevent leakage of that caustic substance. So if you have it, don't delay going to hospital to find honey, to buy honey, to borrow honey. But if you happen to have it, it's worthwhile giving that en route.
Yep.
When you get to hospital, we need you to advocate for your child, because sometimes, particularly over festive periods, holiday periods, emergency departments are very, very, very busy, but you need to state very clearly that you believe your child has swallowed a button battery and may have one lodged in their gullet. If there's any delay, you again need to speak up and say, hey, I understand that if my child has swallowed, we need to be removing this within 2 hours ideally. I understand my child needs immediate x-rays. And I would be jumping up and down and making whatever hullabaloo I had to. Yeah.
Yep. Definitely a more urgent thing than what the child looks. So often in the emergency department, the kid is triaged based on the story, but you'll often have an eyeball from the end of the bed or from across the counter, and you'll sort of go, that kid looks sick, that kid looks fine, that kid looks super unwell. And so often kids who've swallowed a button battery, they may very well look perfectly fit, happy and well, but that may not be the case for very long. And so this is definitely a, hey, let's do something ASAP problem. Yeah.
So you have our permission not to be a polite, reasonable human being. Now, don't be rude and aggressive, but you do have to be assertive and advocate for your child. Yeah, definitely.
Absolutely.
So I would hope that the triage person understands the significance, but everyone has their first day on the job. So if parents feel they're getting nowhere, what are their options, Moz? How can they move things along in this genuine emergency?
Yeah, so I think if you feel like you're not being taken seriously at triage, or the story hasn't quite landed with the triage nurse, then I think you want to try and ask the triage team to ensure that the story's been at least run past the emergency department consultant on duty. So there'll usually be a person in charge of the shift. So you want the story run by them to see what the timing should look like. And if you're not, if you're getting resistance in and around that, then I would actually advocate for calling the patient liaison officer and trying to advocate through that channel as well. So this is definitely not something that a senior clinician is going to ignore. You just need to get the story run past a senior clinician.
Yep. So hopefully it won't happen, and it most often happens, the button battery ingestion. Obviously it's an accident, but tends to be when parents are actually changing over the button batteries, that they take the old one out and put it down for a nanosecond while they're putting the new one in, and Junior grabs the old one because it's a shiny, smooth, fascinating little object. So again, great care when you're changing over these button batteries. Like, don't put them down even for a second, because for some reason they seem to attract small children. So
prevention is definitely better than cure.
Yeah, we won't say any more about button batteries because there is a whole podcast if people want to get an idea of the sort of injuries that they can cause. But trust me, they can run through a gullet, they can perforate into blood vessels, they can cause long-term problems with swallowing and digestion, and occasionally have caused death. So please take it seriously.
So just on that topic of the other podcast, if you remember, Dr. Ann, we shared a link that you had found for someone who was doing a test run on putting a button battery in a chicken and watch it like a chicken breast and watching to see the reaction. For about 4 to 5 weeks after that, I was getting all sorts of variants of that, and some of them were actually quite hilarious in terms of the commentary that was attached to them. So I think if someone has not seen it, they should look at podcast number 4. And then if they're lucky, the Instagram algorithm will lead them to a very happy place. And I think that'll be good. And hopefully the Instagram algorithm will lead you to your happy place. And so I would encourage you to watch that video because it is quite educational. Fair
enough. The next one, which is usually more of an annoyance than a terribly serious thing, but insect bites. Another summer delight.
Yep. So another one where prevention's better than cure, making sure that we're sensible in and around bodies of water, long sleeves, long pants, especially around dusk and dawn and around bodies of water. But really, once it's sort of happened and it's irritating, there's a handful of things that we can do, isn't there, Dr. Ann? What would you recommend?
Yeah. So first thing to do is actually to have a close look at the area that's been bitten to make sure there's not still a sting there. It's usually the honeybee that will leave a sting, but if there's a sting, you've got to remove it. Yeah. And there is a technique to removing it, isn't there, Moz? Yeah. So should you just get your fingers round about it and give a good old squeeze?
That's probably like not ideal, Dr. Ann.
No. That's not popping a pimple.
I would advocate against doing that. No, that's right. Yeah. Any other ideas you want to run by me?
No. I'm happy. I'm wanting you to tell me what to do with it. So I'm not
Fair enough.
squeezing
So
it out,
if
but there's a
you're
thing in.
out somewhere
Yeah.
where you don't have access to any equipment, then often they talk about scraping with a nail. So the idea being that you want to sort of come across and flick it out rather than sort of squish. If you squish, you release lots more protein and you can get a more significant allergy. Whereas if you scrape, hopefully it'll sort of flick off and do its job.
Yeah.
Um,
I think there's been a recommendation to try using the edge of a credit card, but the problem is that the vast majority of us just pay with our smartwatch
I don't
now.
carry a
Don't carry a
wallet
credit
anymore.
card.
Yeah. Yeah.
I suppose you should have your driving
I'd be
license with you, shouldn't you? Well,
It's
you
digital
note the
now.
use of should.
Vic Roads has an app, Dr. Anne.
They have indeed.
Vic
'Cause
Roads has an
that's
app.
what
Yeah,
I agree.
no,
That's what I
I'm
use when
not
my
sure.
husband says, "Where is your driving license?" Because it's never on me, but I have it on the app. Yeah, so you
Maybe,
can use
maybe
a
if we have a
card.
listener from Vic Pol, they can let us know if we still need to carry our license now that there's an app that has the license on it. Don't know.
Okay, so we have either removed the sting or there was no sting. What can we do to make the bite area more comfortable?
So I would probably recommend, so really simple things: wash the area, make sure you get any debris and rubbish off, whack a cold, wet cloth over the top of it. Maybe think about, wrapping a bag of peas or something like that in.
So we can ice this one. We're okay to ice.
We can ice this one.
Right.
We never direct ice anything, just about. And so a bag of ice with a warm face towel or an old t-shirt or a rag or something like that. And then the other thing to think about is whether you want to use any medications that you think that might be helpful in this context, Dr. Anne.
Sure. So an antihistamine tablet or syrup, depending on the age of the child, is usually quite helpful, and particularly if you know that your own little kiddie tends to get the sort of redness and swelling and the giant red swelling things round about where they've been bitten, then early antihistamine probably will help with that. The other thing that you can use if you have it kicking around the house is really any old cortisone cream, isn't it? A wee dab of that will help.
Yeah, I'm pretty liberal with the antihistamines in my house. So we definitely use a lot of antihistamines, and if you've got a kiddo that suffers from nasty, allergies or hay fever or whatever the case is, and you've got some antihistamine laying around, I'd definitely be pretty liberal with that. I think for me, the over-the-counter steroid, I'd definitely be thinking about that primarily if it became itchy, angry, or miserable. Would you use it before it sort of got angry, or would you wait till it got nasty?
If my kid, as one of mine does, has a track record of developing impressive itchy urticaria reactions after, I would give it early to try and stop it happening. Just one application, yeah? Like the antihistamine and whap on some steroid cream and see how it goes.
Yep. Yeah, absolutely. I've got nothing else to say about insect bites. What about you, Dr. Anne?
Well, I do have something else to say about insect bites, although it's not peculiar to insect bites, but very, very, very occasionally after a bite by an insect, particularly from a bee, a wasp, or a jumper jack ant, you can get a much more serious condition developing. And the first time that it happens, it will be a complete surprise to everyone involved. And obviously I'm talking about anaphylaxis, yeah?
Which may as well be the next thing that we talk about.
I think so. Were you wanting to save this till the end? Sorry, Dr. Moz?
No, anaphylaxis is great. So, anaphylaxis is not great. Anaphylaxis is horrible and scary and very traumatizing. So anaphylaxis, I guess by definition, everyone sort of thinks anaphylaxis is a nasty allergic reaction, and that's kind of true. But we sort of need two body systems to be involved for it to count as anaphylaxis. So for those playing at home, that would be the jumper jack bite going a bit red, and your kid feeling breathless or having lip swelling or tongue swelling or, feeling flushed or having nausea or vomiting or diarrhea or some other body part sort of playing along. And characteristically, Dr. Anne, these are not slow reactions, are they?
No, they can occur very quickly, often starting within 20 minutes and certainly usually within 2 hours or whatever the thing that is triggering it. As you said, the first time it happens, it will take you by surprise. Often a rash or swelling rounds about the lips or the face or the eyes can be the first thing, but the rash can spread before your eyes. It's quite scary. And then if you have trouble breathing, tummy cramps, diarrhea, sometimes they can also go quite pale and floppy on you. Ultra consciousness, you have to take it very seriously. So if someone suspects that a person who has had an insect bite, or indeed it's just that anyone is having an anaphylactic reaction, what should they do?
So without fail, before you do absolutely anything else, call 000. So you must make sure that somebody is calling 000,
Yep.
because this is a scary problem to have if you're on your own, especially if you don't have an EpiPen. But even if you have an EpiPen, sometimes you need more than one dose of adrenaline. So you want to make sure that someone is calling 000. And then step number 2 is you want to get that EpiPen rocking and rolling. And if we already know that you have anaphylaxis, then hopefully you've got one floating about and you've been shown how to use it and all that sort of jazz. But if not, really, we're calling 000. That's really the key thing, isn't it, Dr. Ann?
Sometimes, I mean, allergies are much more common these days than they were 20 years ago. So depending if you're in a place where there are other people, someone may have an EpiPen. So, So someone looks like they're having anaphylaxis, you lay them flat, you call 000, and if an EpiPen is available and you know how to use it, then go ahead and give it. But even if they seem to start to recover, are we good? Are we, if the person comes around and seems their normal self, are we cancelling that?
We are so far from good. And so I think the problem is once some adrenaline's been hit, we actually need to observe you in hospital for at least 4 to 6 hours. And the reason we need to observe you in hospital for at least 4 to 6 hours is, unfortunately, number one, sometimes that first dose of adrenaline is not enough and you need a second or a third or a fourth or a fifth dose. And then number 2, even if that first dose of adrenaline is seemingly enough, there is another problem, isn't there, Dr. Ann?
Because sometimes you recover and then 20 minutes later, sometimes less than 20 minutes later, you're straight back down and out again.
Rebound anaphylaxis.
So the EpiPen really is about buying time to receive expert care. It's just keeping you alive until the ambulance arrives, and then the ambulance will give you more adrenaline if you need it, as they're transferring you to hospital. But please don't ever be fooled by an apparent recovery after an EpiPen. Don't be thinking we're good. We don't have to ruin this day out by calling an ambulance and going to hospital. You absolutely do.
There's no better way to ruin your day than by not calling an ambulance and needing one. So I would definitely be calling an ambulance. And should we very briefly cover EpiPens, Dr. Ann? So maybe if we're sensible and organised enough, we can flash a photo of an EpiPen up, but it'll have a blue end and an orange end, and there's a cute little rhyme, isn't there, for remembering which side goes where?
So cute little rhyme, Dr. Moz, tell us more.
There's a cute little there's a cute little rhyme for remembering which side goes where, and it's blue to the sky, orange to the thigh, because there is a little sharp needle on the orange side, and if you stick that into your finger, you're not going to have a good time. And the person who's having an anaphylaxis is not getting any medicine. So the blue side goes up to the sky, the orange side goes into the person's thigh. So that's the best way to remember it.
Okay.
Excellent. Anything else you want to cover?
There's one other adrenaline auto-injector available in Australia. It's Anapen, is it? Yeah.
Yeah, I think that's the other brand name. Yeah, that's right.
It has the same color coding, I'm hoping.
That's right. Yeah, so I think they've both got the same color. Yeah, and if they don't, we'll make sure that we flash it up here with a little message that corrects me if I'm not correct.
Hey there, it is Future Dr. Moz on behalf of Future Dr. Moz and Dr. Ann. We had a look at the Anapen to ensure that it was the same color, and it is not the same color. So only the EpiPen branded EpiPens have the orange and blue coloring. So of course that's blue to the sky, orange to the thigh. The Anapen, which is the other brand of adrenaline auto-injector, is not color-coded other than to tell you what strength the Anapen is, but it is clearly labeled with needle side this way, which means that hopefully you won't have any problems working out which side goes to the patient and which side goes to the person whose thumb is administering the injection. Take care, stay safe, and enjoy the rest of the podcast.
And so the other thing to say is that very occasionally someone will have anaphylaxis, will become unresponsive and will not be breathing properly. In that situation, you do need to commence CPR. So if you do nothing else these holidays and you don't know CPR, then that would be a great thing to do while you've got a little bit of downtime.
So probably beyond the scope of this podcast to teach you CPR from scratch, but maybe within the scope of this podcast to recommend that you sign up for a CPR course if you haven't already done so.
Yep. And there are loads of them available online now, aren't there, where you do your theory online and then just go somewhere for an hour or so, practice on the mannequin, and they will tell you, correct your technique if you're not competent. And we're looking at, what sort of cost are we looking at for one of those, Dr. Moz?
I think the cost varies depending on how much face-to-face time you're getting, but I think somewhere between sort of $50 up to $100 is about the ballpark. Some of them might be more, but you might be getting more for that $100. So I think if you're looking for what's the bare minimum, it might be $50 or $60.
Yeah. So it's definitely doable for the vast majority of us. Yeah, maybe.
Yeah.
The best present you give yourself is to learn how to give CPR to a loved one in future. Yep. Okay.
Exactly. And may you never need that present. And lastly.
So again, something that I have would touch all the things I've never had to deal with, not being a true local. I've been here 17 years now, but probably only seen half a dozen snakes. But snake bites, we should know what to do.
Yeah, absolutely. So once upon a time, I did used to be an emergency doctor, so I did have some interaction with snake bites, but it has been a hot minute since I've had to deal with one. And we are Melbourne green wedge based, so unfortunately, people who actually do see us are in a place where there are plenty of snakes flying around. So I think this is an important piece of first aid for you to sort of be trying to pay attention to. And I guess, again, there's a bit of a consistent theme here, which is send for help. So make sure that someone is calling 000. But in terms of the actual snake bite, there's a couple of things. When we think about those sort of CPR style courses, the first thing they talk about is danger, and danger is get the hell away from the snake. That's step number one. Make sure you are putting some distance between you and the snake, and that you are getting out of harm's way. And then after that, make sure that if you are coming to help someone, that you are not going anywhere near that snake either, and that you sort of know where that snake is or is sort of headed. What's step number 2, Anne?
So we've dialed 000 or made sure that somebody else has. And if you're getting someone else to do it, then don't please do a random shout out to the people standing. Can someone please call? Look someone in the eye and say to them, can you call 000 and say we've got a person bitten by a snake, and let me know when you've done that. You have to be very bossy. Now, some of it comes really easy. I'm very bossy. It's a natural talent for bossiness. Moz has no idea what I'm talking about. But you need to, because if you just say in general, if there's more than one person there, you say, can someone, and everyone just let somebody else be that person. So choose a random, look them in the eye, ask them to do it and to tell you when it's done. So we're called 000. The next thing to do is the technique that is used for snakebite is called pressure immobilization, and it really is about bandaging the affected area and then applying a second bandage along the length of that limb so that limb stays as still as possible. It doesn't bend at the joints. You're really just trying to prevent any venom from spread. No, you can't prevent it completely, but minimize spread of the venom from the affected area. That's pretty much it, isn't it, Moz?
Correct. So most of the Victorian snakes are going to cause a problem by way of the venom traveling up the bloodstream and causing problems with the way the blood works. And so essentially by immobilizing that limb, we're stopping the blood from continuing to flow further upstream where it's going to cause more and more injury. So definitely trying to immobilize that limb is really helpful, and trying our best to sort of stay put until an ambulance gets to you is great. It's obviously we do want to stay safe. And so if you need to move away from the snake, then you do that. But once you've moved away from the snake, you're not going for a long hike to your nearest emergency department. You are staying put until someone can get to you for sure.
Yeah. And before you put that bandage on, is it helpful to clean the wound?
Please don't clean the wound. So, sometimes, and it's actually interesting, isn't it? Because I think it can be helpful for trying to identify the snakes, but we look together because, like you sort of said, I haven't seen one in probably 10 years since I last saw one. But the Royal Children's Hospital suggests at this point in time that essentially they just give you both anti-venoms, and so they don't really use the venom detection kits anymore. But it's still worthwhile actually just leaving it alone and just immobilizing it and not fussing about with any other things. Just immobilize it, call 000, and then let them deal with it.
Keep them calm. The other thing to say, so is it sometimes if you are where snakes are, you might not necessarily be in an area with great mobile phone reception. So if 000 isn't connecting for you, there's another number that you can call. You can try calling 112. Yeah.
Yep. Absolutely.
And it's worth knowing that.
And I think the other thing that maybe we'll briefly touch on is the kinds of things that people can experience when they've been bitten by a snake. So you can obviously, other than, hey, it hurts, like where I've been bitten, you can feel like slightly nauseous, slightly lightheaded. You can get weird like neurological symptoms in terms of like blurred vision or nausea or headaches. But generally speaking, none of that changes your first aid. So it doesn't really matter what the symptoms are. You still want to call 000. You still want to be assessed by an emergency department, and you still want to be considered for antivenom if appropriate, because it can lead to significant injury.
What if you've been bitten and you feel fine? Can you just?
I would still bloody go to an emergency department. There are people within our community who are very, very good at being able to tell what snake is what, and maybe they can look at it and be very comfortable that it's not a venomous snake. But to be honest, even if I'm that person in a fight or flight situation, we're humans. Maybe we make an error in identification. It's not worth risking it. Very recently in 2024, a very well-respected snake catcher was hospitalized for a prolonged period of time after an envenomation. So even the people who are really good can end up with significant risk of injury. So it's not something to be messed around with, for sure.
I think I would be as good at identifying snakes as I am at identifying which wild mushrooms are safe to eat. So not good at either of those things, and it's in the same category.
I'm very good at identifying snakes. They're all called nope ropes. Every single one of them. Excellent. All right. So I think that's probably the highlight reel, isn't it, for snakes? Have we missed anything for snakes?
Anaphylaxis can also occur after a snake bite. So anaphylaxis is not unique to insect bites, and anything can cause it. And the same person can lose consciousness and have abnormal breathing. And if that's the case, if you know how, you need to, you ideally would start doing CPR. But obviously you have to stay safe yourself. You need to stay away from where they're bitten, So that's the other thing. If you happen to have a marker pen with you, it's great to put a big arrow to show approximately where the bite is. But again,
because what they'll want to know...
I don't know that I go hiking with a marker in my bag. Maybe I need to.
Maybe if you're planning a first aid kit and you're putting a snake immobilization bandage, throw a Sharpie in there. The emergency department doctors will thank you for it. And the reason it's valuable, like you've said, Dr. Ann, is essentially when we unwrap that bandage, we don't actually want to unwrap the whole bandage. We want to create a small hole in that location if we're going to use a venom detection kit. But like we sort of said, we're both reasonably out of practice and haven't seen a real life snake bite in forever. And so it sounds like we don't really need to stress about that, but still probably a nice touch. And again, perhaps you're not in Victoria where, there's more than one type of snake that can cause you a problem. And so maybe you're in a state where they are going to use that venom detection kit before giving you anti-venom. So throw a Sharpie in your snake kit, in your first aid kit.
Yeah. So I think that's enough for today. And we sincerely hope that you don't need any of this advice over the holidays that are coming up. We hope you have a safe and wonderful and relaxing time. But these are just headlines of things that might turn out to be useful. I suspect that there will be one or two nosebleeds amongst the audience. I hope not, but there's a possibility of hopefully only minor burn or scald. And there almost certainly will be some insect bites, because not everyone could sit next to me, because that would work for everyone else. If you sit next to me, I'll get all the bites. Yeah, that's how it works. As I say to my husband, it's really nice to know that I'm totally irresistible to one form of life. So,
there you go.
Works well.
So
anything to add,
as
Dr.
always, a bit. No, just a very big thank you for everyone that's listened to the podcast so far this year. We really do appreciate all the feedback that's coming through on social media and in our emails and in person as well. We hope that people find this particular episode helpful, but also the podcast series in general helpful. If you do find it helpful, pretty please hit like on the social media reels. Pretty please do share the podcast around. It's one of the most valuable things that you can do for the podcast. And hit 5 stars on Spotify and Apple Music. And we are finally on YouTube, even though we've been saying it for the last few weeks. We are finally on YouTube with the most recent episodes, and hopefully we'll be live on YouTube with this episode as well. So hopefully all of those details will be shared on all the relevant social media links and wherever you find your good podcasts. Anything else to add, Dr. Ann?
No, I think I'll just add my thanks to yours, to our faithful audience who've really seen us learn how to do this. We're still learning, but yes, we've had some episodes that have been more slick than others in terms of voice and visuals, but we're getting there, and the feedback has been really helpful.
Absolutely.
Okay, so next year will be 2025, next podcast. That sounds quite scary, but yeah, lots of lovely family time and holidays from now till then. So stay safe, everyone. Have a great time, and we'll catch up with you next year.
Absolutely. And as always, Dr. Anne, thank you for your time.
Thank you, Moz. I will see you tomorrow. However, take care. See you.
Ciao.